I don't want to take too much of your time. I know you're all hungry and probably anxious to get up and to head on out. But the elders specifically asked me to come and talk a little bit about this virus, and so I thought, well, let's do something practical with it. I want to tell you a little bit about what it is, where it might be going, and then applications for us, both physically and spiritually. The virus causes a lower respiratory type infection similar to a bronchitis or the flu, a fever which can be high, chills, aches and pains, and a cough, and usually a dry cough. It does not really involve a lot of upper respiratory problems like a sore throat or earache or severe nasal congestion. But there are 7 different coronaviruses so far identified, and 3 of those do cause a regular cold, common cold type of picture. And so it's been around for a while, these other strains. It's estimated that 30% of common colds are actually due to the coronavirus and not the rhinovirus types, which cause a typical common cold. Right now, as of yesterday, there's 143,000 cases worldwide and 5,400 deaths. If you do the math, that comes out to a fatality rate of about 3.5 to 3.7%. And that sounds really bad. But if you compare this to what we've seen before, you might remember back in 2002 and 2003, the SARS, severe acute respiratory syndrome, and that started in China. There was primarily that one outbreak, but there's been 4 minor outbreaks of that in the years since that time. It's not completely eliminated, but it's no longer considered a concern for a pandemic. The fatality rate with that was about 10%. And then in 2012, in the Arabian Peninsula, there was the MERS, Middle Eastern Respiratory Syndrome, another coronavirus. Its fatality rate was about 35%, and a flare-up in South Korea in 2015. Although it's not eliminated, it's not really considered a risk for us either. This is a fairly new virus as far as we know, unless it's really, really old and we're just now seeing it again. And the numbers we're seeing with this is far in advance above what the other 2 were. And those fatality rates sound very disturbing, but considering the number of people that were involved and the difficulty in identifying those people, only the really sick people would have been identified, and the really sick people were the ones tested, and so you'd expect a fairly high mortality rate from those who were really, really sick anyway. And then we come to what's going on with this new one, the COVID-19, the fatality rate of about 3.5%. Well, when we look at influenza, that rate's only about 0.1%. So this sounds terrible, like we're all at a severely high risk. But when we begin to break it down, estimates are that this probably has been going on longer than we think. It was first reported in China in December, but really began at least in November, if not earlier, and it was not reported until December. So looking at that, it's plenty of time that may have spread a lot farther, a lot earlier than we realized. The head of the Ohio Department of Health estimated that maybe 100,000 or more people in Ohio already have been exposed, because many cases either have no symptoms at all or very mild symptoms, just like a simple cold. And so people could have had it. People in this auditorium could already have had this virus and not have known. Well, should we worry about that? Well, primarily not. Testing has been delayed in this country because we developed a new test that was not being used by the World Health Organization. And as we start testing more and more people, we'll probably start seeing more and more positive tests. Will we start seeing more and more deaths? Well, as the total number of cases rises, the answer is probably yes, but the percentage will probably drop significantly. There's 26 cases in Ohio as of yesterday. If there's really 100,000 or more people that have been exposed in Ohio, then we're going to see more deaths, but we're also going to see the percentage of people who have severe illness or die from it is very, very low. If you multiply the 143,000 by 10, then your mortality rate drops from 3.5 down to 0.35, and so forth. The influenza has been around for centuries at least, and because of that, everyone has a little small degree of immunity to influenza, regardless of the strains. When there's a fairly new strain, that's when we have a bad flu outbreak, like the swine flu, although that's not new either. So there's a little bit of immunity conferred. There appears to be none of that with this one, but if this becomes a regular problem year to year, that will eventually happen over several years, and we'll all become somewhat, at least partially immune to this, and we'll see a decrease in the severity of what's going on. Well, so there's 4 probable outcomes of what will happen here. Number 1, with all the things that we're doing around the country and around the world, it will be stamped out or eradicated. Now, eradicated doesn't mean gone. MERS and SARS are, quote, eradicated, but they're not gone. There is the opportunity for them to come back, although it's not very likely. It's unlikely this will happen because the cat's out of the bag already, and so there's probably a lot more cases out there than we realize, in which case we'll just have to put up with it. But that's one possibility if that happens, okay? Past that, another possibility is that a vaccine is created if this persists. But that's going to take at least 17 to 18 months. So that would put it back into the spring of 2021 before that can come around. Enough time that if this recycles to the next year, it'll be back, but people will be able to be vaccinated. Another possibility is that it'll go down, as many respiratory viruses do, in the warmer months. Colds aren't so frequent in the summer. Flu is not frequent in the summer. It's very rare. So we begin to see that might cause things to abate, or maybe even stop. Our containment might slow it down. The weather might slow it down. We might get a vaccine. The other possibility, and probably a very likely thing, is that it becomes a yearly repeating pattern. But over time, it'll become less and less severe as more and more people see this virus. And as more and more people see it and they have a small degree of immunity, it will still be very severe for those who are most at risk, but that percentage will drop significantly. Who is most at risk? Those who have respiratory problems like severe asthma, those who have a depressed immune system because of medications or medical problems they have, the elderly. So far, there are no deaths in people under age 10. There's now 1 case of someone getting it in utero, but we don't know the outcome at this time. But that goes up exponentially after age 60, about 3%, and then in the 70s, about 5 to 10%, and past that about up to 14% for those over age 80. That doesn't mean if you're elderly you should panic. It just means we should be careful. So the elders have put out 2 emails so far, and Carrie Childers mentioned some very important things that they're telling people when they go to the emergency room, and we appreciate that too. It's the obvious things. Number 1, if you're sick, stay home. And that's true really whether you're going to church or going to work or going anywhere. Don't spread it to other people. Number 2, don't handle and touch things, especially other people, especially if you're sick. If we don't shake hands, if we don't hug people, that greatly decreases the transmission. If you touch surfaces, which we all do, then wash your hands. If you touch your face a lot, which many of us do, then make sure your hands are washed. Avoid situations where you know you might be exposed. Stay away from people that are very sick. If your family is sick, you might stay away from other people, but you don't have to quarantine yourself. There's no need, if you have no symptoms, to go around wearing a mask. It's not necessary to do that. So these are some obvious things, and that's what we should do. We're trying to do that very thing this morning you saw with our worship. How long this will happen, I don't know. The incubation of this virus is about 1 to 14 days, median of about 5 to 7 days. So most people, if they're exposed and they're going to get it, within a week they'll have symptoms. The length of illness is up to about 2 weeks. Maybe a week to week and a half would be average, but 2 weeks is the maximum so far. That's why you're hearing about a 2-week period to be away from things. Really, it should be 4 weeks, I guess. 2 weeks of incubation and 2 weeks for all the sick people to get over it. So there's no need for panic, really. I think that's the important thing. We don't want to lose sight of what we're doing here. And the other thing, I think, and this is the most important thing for us, is a spiritual application. If you're off of work for 2 weeks, use the time wisely. Pray. Pray for other people, not just the people that you know that are sick or those who are in your family. Pray for the world about this illness, that it may not spread. Pray for the economy if you wish, because that's taking a hit right now, and who knows where that's going to go. Spend time studying your Bible. Spend time with your family. If you've said, well, I never get to be with my family, and you have a few days off, do so. Number 2, reach out to the body. There's people here that are ill. Maybe they even have the virus. We don't know that. But pray for them. Look to their needs. If someone is home and they're ill, call them. Send a card. Ask if there's something you can do to help them out. Bring them groceries. Those extended care facilities and assisted living facilities primarily are all closed down. It's been left to the individual, but I don't know of any that have not closed themselves to outside visitors. Those are people that need our help anyway. Contact those people. Let them know you care about them. Let them know you're praying for them, and ask if they have needs that we can meet. And then finally, to the world. Show people how we're supposed to live. Show people that we are not in a mode of panic. People are acting badly in public. Just go to the grocery store. It's pretty obvious. Show people how to act. Share with people. Look to their needs. Be polite. You know, this is an opportunity to panic, but it's also an opportunity for service. It's an opportunity to get closer to one another, to learn how to meet other people's needs, not just in the body, but even in the world. Jeremiah 17, verses 7 and 8, "Blessed is the man who trusts in the Lord and whose trust is the Lord, for he will be like a tree planted by the water that extends its roots by a stream and will not fear when the heat comes, but its leaves will be green and will not be anxious when a year of drought comes, nor cease to yield fruit." Our Christian service, our Christian love, our concern for one another should never change regardless of our circumstances. This is not a time to panic, just a time to be careful, a time to pay attention, and a time to remember to serve. Be careful when you go home, and have a good lunch and good rest of the day, and spend some time in prayer for our situation. Thank you.